today we're going to be talking to you about sleep apnea, which to anybody who's not sort of familiar with it, they may think that's a strange thing to talk to a dentist about, but not so much these days. Why is that?
Well, sleep apnea is a condition that 10% of the population, at least in our country, is probably suffering with, and that's an estimate. But and most of those people are undiagnosed. Okay. So the advantage of a dentist is we're looking in the mouth. We're seeing the signs and symptoms of sleep apnea, as well as having conversations and discussions about sleep. But we can kind of tell if someone has the signs of sleep apnea: grinding, clenching, rest, they're not getting a good night's sleep, and the way the tonsils are, the soft palate. We're able to look at that sort of stuff and get a good judge if someone is a likely person who has sleep apnea.
Okay. So somebody comes to you, you diagnose sleep apnea, what's next?
Well, for those of people who don't know what sleep apnea is, it's the condition where we stop breathing. The airway is actually closed. We're not getting oxygen, and it happens while we're asleep. So we're not really aware of it, but it's taking a toll on our body, both our sleep, the amount of sleep and quality of sleep we're getting, and then it's putting stress on the rest of our body, our heart, our central nervous system. So it can lead to other conditions such as stroke and heart attack. Oh, so
it can be potentially fatal if it's left untreated.
Yeah, I mean, it's definitely a risk factor for those things. And so this is something that I have as sleep apnea, so I'm kind of passionate about trying to find people who have it so that we can give them those extra years of their life that they may not have had if they weren't treated. So what do? If we recognize it, then we can send people home with a home sleep test. It's a way to take a sleep study that we hear about, that we can do at a hospital, but now we can do it at home, and it's really accurate, it's really easy, and it can give us all the data that we need to diagnose with sleep apnea in conjunction with your physician.
Okay, so we'll actually have a look at your sleep test apparatus in a minute, but first of all, we're going to be concerned about this because obviously the health consequences if it's left untreated. We've covered that, which can be potentially fatal. How would a dentist spot this?
Well, like I said, so clenching and grinding can be a sign of sleep apnea. You're actually trying to protrude your jaw forward in order to open your airway, and then looking at your soft palate, things like that. But in our office, that's something that we ask people about to try and find out, are you someone who suffers from sleep apnea? And we're here, we're looking in your mouth. We see you every 6 months usually, and so we can have that conversation and try and diagnose you.
Okay, so something that other people should be passionate about too, really, because the consequences can be dire. We're at Aspen Dental. Tell us where we are and how people can make an appointment to come in and see you if they have a concern about this.
Sure, we're right 1451 North, 200 East, right by Mountain America Credit Union. Our phone number is 753-5166.
Okay, so if you feel that you do have some of these symptoms going on, contact Dr. Wegener here at Aspen Dental, and they'll fit you in and get you going. Thank you.
Thank you.